I'm doing my speech on supporting physician-assisted suicide. Is physician-assisted suicide ethical? Physician-assisted suicide has been a major ethical and legal dilemma for terminally ill patients and doctors alike for many years. This controversial situation occurs because physician-assisted suicide is illegal in 49 states except for Oregon. Now you're probably wondering, what exactly is physician-assisted suicide? In definition, physician-assisted suicide is defined as the voluntary termination of one's own life by administration of a lethal substance with the direct or indirect assistance of a physician. Physician-assisted suicide is the practice of providing a competent patient with a prescription for medication for the patient to use with the primary intention of ending one's own life. Physician-assisted suicide is commonly confused with euthanasia. One way to easily differentiate these two terms is to look at the last action performed in the situation. Using this distinction, if a third party performs the last action that intentionally causes death, only then can euthanasia be blamed. However, if the person who dies performs the last action, assisted suicide has then occurred. So now you're wondering, what do supporters have to say? Well, supporters of physician-assisted suicide firmly believe that it is a fundamentally and individual choice, and that no one should be controlled by the laws against physician-assisted suicide. Supporters continue to say that they believe patients should have the right to make life decisions and not have the government constantly meddling in their lives and their own every day-to-day business. To some patients, the thought of suicide reduces the effects of anxiety and helps the patient to appreciate their final days of life in peace. Now, where the argument begins, there's three different conditions. Condition 1, the patient is close to death. Condition 2, the patient is in unmanageable discomfort. Condition 3, the patient is mentally competent to make a voluntary request for physician-assisted suicide. What proponents fight for? Proponents fight for compassion. They stand for the fight of eliminating suffering among all terminally ill patients. They firmly believe that the prohibit physician-assisted suicide is to put a limit on personal liberty. In conclusion, I'd like to say that some proponents believe that prevention of suicide is an infraction of religious freedoms. But it is also very important to remember that there is not a single sentence in the American Constitution that puts any limit on committing suicide. Thank you.